Yang Berhormat Dato Sri Dr. Adham Baba, Minister of Health, Yang Berbahagia Tan Sri Majid Khan, Deputy Chairman of KSI, Yang Berbahagia Tan Sri Dr. Abu Bakar, former Director General of Health, Excellencies, distinguished speakers, Dr. Dato, ladies and gentlemen. At the outset, allow me to extend a very warm welcome to all of you to be with us here today for the Malaysian Healthcare Conference 2020. I think for many of us, it's the first time that we are gathering at a physical meeting to discuss issues and challenges facing the healthcare sector. I must thank the Honourable Minister for taking time off your very busy schedule in Parliament to be with us here this morning. I must, on behalf of all of us, extend our heartiest congratulations to the Ministry of Health and to the Minister, Yang Berhormat Dato Sri Dr. Adham, for the success that we have had in combating the invisible enemy, COVID-19. It has been recognized that Malaysia has been doing better than many other countries, thanks to the Ministry of Health, the National Security Council, and all our frontliners, and with the support and cooperation of all Malaysians. We must remain steadfast to comply with all of the SOPs that the MOH and MKN has come up. Although we are facing challenging times balancing health and economy, life and livelihood, I believe that many Malaysians fully support the Ministry of Health's recommendation for an extension of the RMCO. And personally, I think for prudence sake, we should continue the RMCO perhaps until the end of this year. The battle against COVID is not over yet, and we cannot afford to have another wave of infections. Ladies and gentlemen, many challenges are facing the healthcare sector. This morning, the first session that was so ably moderated by Tan Sri Dr. Abu Bakar has highlighted some of these issues. We need to also address issues of accessibility, affordability, and assurance of quality service, the 3 A's that I think are very important to ensure that we can move forward in the healthcare sector. Digitalization of healthcare is another important area. With the increase in digital health during this pandemic, as well as with telemedicine growing in importance. AI, or artificial intelligence in healthcare, is a new and strategic area that needs to be developed. Healthcare manpower planning is also, I believe, an important area for prioritization. Having a long-term manpower plan for the healthcare sector is needed that will identify the needs for doctors, specialists, nurses, and paramedical workers, perhaps over the next 10 to 20 years. I would like to suggest that there is a need for a new tripartite partnership between government, business, and civil society organizations to improve public health care in the country. And as Tan Sri Dr. Abu Bakar said earlier in chairing your earlier session, we need to put patients first and to allow patient choice, which are important key challenges for the healthcare sector. Ladies and gentlemen, I would like to once again thank the Honourable Minister for being with us today. Thank you to all of our many distinguished speakers and to our strategic partners and sponsors for your support of this conference. Thank you everyone for coming. Sekian, terima kasih.
Thank you, Tan Sri. Now it is with great honor that I invite Yang Berhormat Dato Sri Dr. Adham Baba, Minister of Health Malaysia, to deliver the opening keynote address.
Bismillahirrahmanirrahim. Yang berbahagia pengurusi majlis, yang saya sayangi Tan Sri Dr. Michael Yeo, Presiden KSI Strategic Institute of Asia Pacific, Tan Sri Majid Han, Deputy Chairman KSI, Excellencies, distinguished guest speaker, member of media, ladies and gentlemen. It is a great honor to be here at this conference to deliver the keynote address on the topic of innovation technologies, shaping the future of healthcare. I would like to thank KSI for this opportunity and for choosing the theme, which is relevant with the current healthcare climate both locally and globally. My text today is quite long, so that you can get and discuss along the conference for the whole session. Today we face one of the largest global challenges for our generation. We remember the Spanish flu in 1916. The impact of COVID-19 is undeniable, and it has tested us as nation remarkably. That is why we must all work together to ensure the health and financial safety of the rakyat being taken care of, while also minimizing global economic damage. As the COVID-19 pandemic unfolds in front of our very eyes, affecting more and more countries and even more people, governments around the globe are taking drastic measures to curb the spread, while scientists race against time to find the effective vaccine. It's paramount to be attentive to the advice of recognized health institutions and local authorities. As for today, Malaysia is in the recovery movement control order from June 10. We do hope that the number of new cases will continue to decrease. We urge the public to adhere to the ministry SOPs and cooperate to ensure that Malaysia is free from the disease. During the pandemic, more organizations choose to work from home. More students are learning remotely, and more people are shopping online and relying on delivery services to minimize travel and outdoor activities. With the travel restrictions and work from home option put in place, it actually accelerated digital transformation, putting forward new requirements for telecom operators to upgrade their services to meet new capacity demand. Given the foundational role ICT infrastructures has played in helping manage the current pandemic, government are even more aware of the productivity and socio-economic benefit brought forth by common broadband communication and cloud services. Digital solutions have provided critical connectivity between global and local healthcare experts and frontline medical professionals, allowing them to conduct online consultation for more effective public health activities, diagnosis, and the intervention with faster identification and to reduce spread of infection. In Malaysia, the country's early attempt in transforming healthcare was the launching of our own telemedicine program in 1997. Another early contribution in this space was the Malaysian Health Data Warehouse, MYHDW, a key initiative commenced in 2013. Malaysian Health Data Warehouse has been promoted as a sound national platform for the integration of health data, intended to improve strategic decisions. In addition, nearly 30% of Ministry of Health hospitals in the country have implemented hospital information system, including EMR, electronic medical record. But challenges to full implementation remain as it is due to software incompatibility and inadequate ongoing support. As in some other countries, private hospitals in Malaysia use systems that are not necessarily compatible with those of other private hospitals, including public hospitals. Health clinic has been long been equipped with homegrown electronic medical records from tele-primary care, that's TPC system in 2005, to the latest TPC OHCIS system in 2017 to cater both health and dental clinic. However, Only 10% of health clinics are equipped with EMR. Ministry of Health is looking at continuing to expand the system to more health and dental clinics to allow seamless and better care for patients, especially with chronic diseases. EMR in primary healthcare will be the source of data for surveillance system by collecting influenza likeliness, i.e. ELI, and all other notificable disease, which integrates directly to e-notification system to provide early case notification and public health action. To further complement EMR system, online appointment system and virtual clinic help to reduce numbers of patients attending the clinic at one time, hence reducing the risk of infection disease spreading with the health clinic itself. The idea of urbanization of health by bringing healthcare service to home is also in the vision of healthcare services delivery in primary healthcare. Despite some of these strikes, the remaining problems with lack of integration between systems, lack of private healthcare involvement, and inadequate long-term investment is inevitable. In last 2 years, the Ministry of Health implemented a paradigm shift to a more modern digital health approach away from the historic focus on telemedicine. Much focus started on digital health and innovation, including research and development in this area. Imaging technologies has become more and more prominent in the health sector, and the Ministry of Health shall provide a network of hospital and health clinic at test beds for those digital innovators. Ladies and gentlemen, before moving further ahead, many would ask the question, what is digital health? In short, digital health refers to the use of digital technologies for health. It is an umbrella term that includes electronic health, e-health, mobile health, and imaging areas such as the use of artificial intelligence, AI, big data, and genomics. As population age and non-communicable disease burden raise, there will be even greater pressure on healthcare system, underscoring the need to deploy current and new technology solutions. Digital health holds considerable promise. It can make health information, care, and diagnosis more accessible, such as through telemedicine. This is especially true for people in hard-to-reach places, given the proliferation of low-cost smartphones and medical devices. Digital health can enable healthcare providers and services to become more efficient, of higher quality. In particular, the enhanced use of healthcare offer the prospect of more personalized and coordinated care and better, faster treatment at a lower cost. AI, artificial intelligence, has advanced to the stage where it can mitigate shortage of specialists, providing reliable diagnosis and lower cost services in field ranging from communicable disease such as tuberculosis to non-communicable disease such as diabetic retinopathy. Similarly, AI can use the greater availability of health data to identify and prevent emerging health issues such as epidemic. Despite the potential benefit of digital health, several nations has put in place the policies, programs, strategies needed to take full advantage on it. And in 2019, Global Digital Health Index, which assessed the state of preparedness and adoption of digital health in 22 countries of varying stages of economic development, measure the readiness of the wider health system to successfully adopt and deploy digital health intervention. The index of benchmark, according to a component of WHO and International Telecommunication Union (ITU) e-health strategy framework, which use 19 indicators in 7 policies area: 1. Leadership and government; 2. Strategy and investment; 3. Service and application; 4. Standard and interoperability; 5. Infrastructure; 6. Legalization; and 7. Compliance and workforce. The Global Digital Health Index observed that Malaysia, the Philippines, and Jordan are well advanced in this area, with fully cost national plan currently being implemented. Malaysia in particular is praised for its integrated digital health strategy, which has been ongoing for 15 years and is linked to the national 5-year rolling Malaysian plan for social and economic transformation. Member of the summit, the rapid emergence of the wide range of application of 3D printing technology and additive manufacturing has been added to the critical occupational list, COL, as compiled by the Critical Skill Monitoring Committee, Ministry of Human Resources. Under the category of precision medicine. This is a new topic. Instead of using metal and hard polymer material for reconstructive surgery, 3D printed material are customizable to suit patient-specific anatomical requirement, not to mention being cost-effective. And Malaysia is well poised to be the hub of 3D device manufacturing in the region. And we are home to more than 190 medical devices manufacturers with investment worth about 13.2 billion. The dawn of 3D technology is actually already well underway here. This has been illustrated by the use of 3D printed facial implant of a female patient involved in a car accident by Dr. Muhammad Nazimi Abdul Jabbar, an oral and maxillofacial surgical expert at Universiti Kebangsaan Malaysia in 2015. Related job that will become in demand in the future world be a robotic surgical engineer, biomedical engineer, nanoscience technologies, genome sequencing specialist, this is important now, and so on. Overall, Malaysia is on the right track to embrace IR 4.0 with the healthcare sector as an engine. By extension, the digitalization of healthcare and the generation of new jobs of the future in the sector will contribute toward a more equitable distribution of income growth, as well as ensuring better quality of life as part of the quest to become a smart nation. Using data and digital technologies for better health outcome is contingent on the nation having a digitally competent workforce. The lack of digital skill is obviously not unique to the healthcare sector, but given the impact of people well-being, it requires special attention. Skill shortage directly undermine the use of digital healthcare intervention. According to the 2019 Global Digital Health Index, the skill base among healthcare professionals is generally low. Only 2 of the 22 countries surveyed by the index include digital health in training for healthcare professionals, with less significant gaps among physicians and more significant gap in training for nurse and community health worker. Skill gaps are particularly pronounced by WHO Eastern Mediterranean region, with Southeast Asia having the stronger base of skill to enable digital health. The need to improve digital skill is recognized as a key objective of WHO Global Strategy on Digital Health 2020 to 2024. The ideal long-term solution would be strengthening digital skill at primary, secondary, and tertiary educational level. However, given resource constraint and the need for quicker result, upskilling health workforce to make them digitally competent could be a more pragmatic strategy. This is done by MOH. Best practice involve introducing digital skill into the health education corridor and curriculum for healthcare workers, for both clinic staff and public health workers. This can be done as part of general capacity building effort, as well as those related to specific digital health project, and could happen at workforce training institutions such as vocational training and private sector-led programs such as reskilling. This private sector-led training and certification scheme could bridge the digital skill gap without people needing to go back to formal secondary or tertiary type education and training. In the longer term, we will need to find a pathway for workers to pursue STEM, that is science, technology, engineering, and mathematics courses, and advanced digital skill. In this area, we will work closely with the Ministry of Higher Education and Ministry of Human Resources to ensure that Malaysia has a ready-made pool for skill and talent needed for digital health. Similarly, the Ministry of Health will need to facilitate people in health policy leadership position have the skill and knowledge to develop and manage in-country digital health initiative and strategy. Distinguished audience. Information and communication technologies were newly emerging when the declaration of Alma Ata was agreed more than 4 decades ago. At that time, the adoption of these technologies in health service was complex, costly, and limited. The commonplace technologies of today, such as smartphone, tablet, and laptop computer did exist. However, by 1990, new technologies, notably the internet, has begun to have a revolutionary impact as they became more advanced in all sectors and mainstream in societies. These technologies have shown remarkable value for health. From technologies that allow people to manage their health more effectively, to better way of diagnosing disease, to monitoring the impact of policies on population health, digital technologies for health or digital health are having a profound effect on how health services are delivered and how health systems are run. The impressive trend in national policy for digital health, more than 120 countries by 2015, reflect the firm commitment to use digital technologies to advance the Sustainable Development Goal, support universal health coverage, and shape the future of primary healthcare. Digital technologies of all kinds have become essential resource in primary care, and their uptake is growing, with the past decade seeing rapid integration of technology in a range of areas that support primary care and essential public health function. In this context, common use of digital technologies include searching medical knowledge resources, facilitating clinical support, monitoring quality of care, and mapping and monitoring the spread of infectious disease, as well as tracking supplies of drug and vaccine. Integrating clinical support tool and referral system into primary healthcare can help coordinate and facilitate its continuity across primary, secondary, acute, and aged care services. Electronic medical record capture information about an individual health, medical condition, medicine, and key event, which can be shared by referral and timely clinical decision making. Digital technologies can help improve the patient journey. They can prevent duplication of care process and enhance communication between providers, as well as avoid unplanned hospitalization and visit for urgent care. And digital technologies will help general public to attain access to timely and expert advice via teleconsultation in health emergencies, which can save life. And digital technologies have already opened up a wealth of possibilities for shaping the future of primary healthcare and effective public health action. They have brought a host of changes in education, policy, and practice, as well as created new pattern of communication, empowerment, and engagement. As a Minister of Health, I can assure you that the Ministry is committed to the goal of primary healthcare and its values of inclusiveness and equity, and promise more chances to come with digital technologies central to the vision and its realization. Once again, I congratulate KSI for being able to take hold such an eventful summit. I wish all the participants today and those who are online, I was told that online also, fruitful and successful decision. Thank you very much.